Hey everybody, so I'm going to go for my ventilator. I already have it hooked up. This is my inspiratory limb and I have my filter on it. This is the expiratory limb. It's all hooked up to my patient. I'm going to turn it on. And say we have a patient coming in, no lung issues, they're having a MI, so the physician asked me to set the patient up on what mode I want and everything. So since they have no prior lung issues, I'm going to put them on volume control. So up here at volume control, I'm going to put them on a rate of 12. A tidal volume, say it's a 5'9" gal, and we're going to put her at 475 for the tidal volume. My peak flow, 29. We're going to start her off with a PEEP at 5. We can adjust it depending on how her blood pressures are, or if her blood pressures are good, we can maybe turn it up a little bit, but we'll start out at 5. The eye trigger, we have a flow at 4 liters per minute. Alright, and then I'm going to activate all those settings, and then I have them on just room air. If they were coming in from EMS, I would probably have that at 100% and I would wean them down to keep above 90. My alarm settings. So my high pressure setting, I want that to be, my pips are at 12.4. So I'm going to turn that down to about 23. And then my low inspiratory pressure, so my PEEP, I'm going to have a low of 2, low volume, tidal volume mandatory, we will turn that down to about 325. My high rate, I'm at 12 beats per minute, so I want that at about 10 above, so 24. My high minute ventilation, I'm at 3.6, so I want that about 10 to 15 above, so 15 should be good. And my low minute ventilation, it's at about a 4, it could be about 3 to 8 below, so we'll go 1.5. It says low O2 because my oxygen on the wall is not reading where it should be, so I'm just going to silence the alarm. It says low tidal volume mandatory, so I'm going to go over and I'm going to look at my patient data. So it looks like they're getting a tidal volume of 301, and I have their tidal volume set to 475, and they're only getting a tidal volume of 303. I'm going to check my patient, I'm going to check for any leaks in the circuit, make sure everything's connected right. I'm going to start with my patient and then I'll work back to the ventilator, making sure that everything is set properly. And then when I do my vent check, I have my papers here, and I'm going to go in, date, time, I'm going to go, and he has on the volume control, so I'm going to put my mode in, I have him on 21%, and then I'm going to go into the patient data here. My patient data is going to tell me exactly what the patient is doing. He is getting 12.6 pips, his tidal volume is 303, his total rate is 12, his SpO2, so I'm going to go in and I'm going to put that all on my assessment here, my patient ventilator check. I'm also going to check the patient, make sure, I assess them, um, and adjust anything as needed. Maybe they're um, not getting, maybe I need to increase the PEEP, so I can put that up to 8. So pretty much just start at my standard settings and take my patient's ideal body weight and work from there and adjust it.